Should we worry as China, the world's most populous nation, embarks on its biggest travel week of the year, the first coronavirus case reaching the United States, and the World Health Organization scrambling? Chinese authorities are on it, screening travelers, issuing updates. Critics on social media wonder if Beijing was fast enough off the mark. We'll ask our panel if China is on top of this, as the outbreak that's thought to have originated in a fish and livestock market in the central city of Wuhan brings back memories of the SARS epidemic that left nearly 800 dead in 2003, with the virus spreading around the same time of Chinese New Year. The difference today? We're talking about a nation where citizens travel much more, with many electing to go abroad for the holidays. Finally, if it's already a problem gone global, how do worldwide authorities like the UN's WHO measure the response? In the age of globalization, how do authorities avoid scaremongering and overreacting while doing what it takes to stave off the worst? Today in the France 24 debate, we're looking at the coronavirus and the fear of contagion. Joining us from New York, Yangjong Wang, Senior Fellow for Global Health at the Council on Foreign Relations. Thanks for joining us.
My pleasure.
We're joined here in the studio by Xia Li, who lived through the 2003 SARS epidemic. Thank you for being with us.
Our pleasure.
Jean-François Di Meglio, president of the Asia Center think tank. Bonne Happy New Year. Welcome back to the show.
Good evening. Yes.
And from Lancaster, England, Dr. Mohammed Munir, lecturer in biomedicine at Lancaster University. Thanks for joining us.
Pleasure to be here.
The France 24 debate on Facebook and Twitter. The hashtag is F24debate. Let's start with the latest. The death toll soaring to 17, some 500 confirmed cases in China, and the virus is indeed spreading after Hong Kong reporting its first case. Mexican authorities investigating a potential case of coronavirus in the northern border state of Tamaulipas. Yinko Yatare has more.
As the number of coronavirus cases increases rapidly, many countries around the world are asking themselves what they can do to contain it. The World Health Organization is meeting this Wednesday to determine whether to declare the outbreak a health emergency. And countries are intensifying efforts in their national airports to prevent the spread of the disease.
For passengers who enter our territory, we have thermal scanning. And if there are signs, we will check their health. And if they're suspected, we will send them to isolation rooms.
The virus was first detected in the Wuhan region in China and has since claimed several lives. It has now hit the US, Thailand, South Korea, Japan, and Taiwan. North Korea is taking a more total no-risk approach. They are suspending all foreign tourism in an effort to completely prevent the threat. In the UK, the Transport Minister has announced that Heathrow will place all passengers coming in from coronavirus-affected regions in a separate area. In France, no precautionary measures have been put in place yet, but passengers are sure to have undergone checks before getting to the country.
At Shanghai Airport, they take your forehead temperature.
Many fear the number of coronavirus cases will increase as thousands across Asia prepare to travel ahead of Lunar New Year celebrations.
Mohammed Munir, should we worry?
Well, if we look on to the pattern of the disease now compared to what it has been 2 weeks before, I must say straight away yes, because the disease has spread not only within inland, but it has spread to other countries now beyond Asia, in the United Kingdom, and few other countries are also suspecting the cases. So looking at just the picture, what we have in last 3 weeks, I think we should be cautious about what would happen in the future.
Yeah, in one 24-hour period, the number of deaths jumping from 9 to 17, the number of cases increasing exponentially. But Dr. Munir, we spoke with one expert who said that as the disease spreads, or as the virus spreads, what's happened in the past is it generally tends to weaken.
Yeah. Sorry, can you repeat again?
Is it the case that there's a good chance the virus will weaken as it spreads?
Well, less likely for a few reasons. But this class of viruses, such as coronavirus, which is the cause for this outbreak, they are RNA viruses, which mean that they have a great potential to mutate. So mutation itself is not a major concern with the viruses because they carry on mutating. But the thing is that if that mutation lead to better fitness of the virus, if that would be the case, then the virus would sustain for longer and it would transmit relatively higher from people to people. And it would probably sustain in the community in a better situation than if it would have not been evolving or if it would not be mutating.
And what are the chances?
The chances for these kind of viruses are relatively high. And if we look onto the genetic makeup, what we have gathered so far, it is not very far from previously characterized coronaviruses such as SARS coronavirus. So we can really mimic the situation, what we are seeing now with the coronavirus, the SARS coronavirus. And if we do so, there are highly likely that this virus would mutate. And probably we have already started gathering information, like 19 different genome sequences are available from viruses that have been collected from different regions. So if we look onto the pattern of those viruses, although there are not many sequences, we will need a little more information to really make conclusive evidence out of it. But based on those information, I think there are fair chances that it would mutate.
Yanzhong Wang, your reaction?
Well, I agree that the virus, like any acute disease outbreak we have seen in history, is going to burn out eventually. But I'm afraid that we are going to see the worst is still to come, given that many provinces in China have just started to test the patients for the virus.
Just starting to test the patients. So they're scrambling at this point. And again, this is very different from 2003 in the sense that the Chinese travel much more.
That is true, and well, now is the Spring Festival, the travel season, that with hundreds of millions of people traveling across the country. But now that the government has informed people about the disease outbreak, I think there's a lot of people, a great proportion of these travelers, potential travelers, they will probably choose to stay at home.
Yanzhong Wang, many thanks. I want to ask you, 2003, when there's the SARS outbreak, which killed up to 800 people.
Yeah.
Do you remember? Where were you at that point?
So I was a student. I was a fourth-year student in my university. So we were very, very...
Where was this?
In Guangzhou. Actually, it was the center of the SARS event. But actually, at that time, as students, we were feeling quite relaxed and safe. Of course.
There wasn't a siege mentality. You weren't under lockdown.
Oh, we were. Actually, the university has requested us to stay within the campus, not to leave and try not to leave and all this. But I never remember like a huge fear of death. We never really got close to anyone who were infected or saying, okay, someone's cousin is infected or something like that. Never. So at that time, I think myself, at least I had the belief that the government is taking care, medical professionals are taking care, and for us, we just have to follow the advice, which means, clean your hands, stay away from people, and then try to open the window and try to have a better environment for yourself.
Of course, the big difference between then and now, we mentioned the first one, which is, of course, the fact that people travel more.
Yeah.
The second was you didn't have social media the way you do now.
Exactly. I think today people got a lot more worried than before. Potentially is one, we had the SARS case in the past, which had demonstrated a really bad example in the past for people to know how virus can be, deathly terrible for people's lives. But on the other hand, today there are so many individual medias writing about this event, and everyone is on WeChat reading about it. So depends on their level of education and how free they are in their daily life, they can be quite panicked.
All right, everyone's an expert. Jean-François Di when you think back to 2003, what lessons do you draw from that experience?
Well, in 2003, we have to remember that in Europe, it was viewed as something quite scary at the time as well. So proportionally viewed from Europe, probably the impact was as big at the time. China was less well known than it's now, and the measures which were taken in Europe vis-à-vis China were quite drastic. If you remember, that's how Jean-Pierre Raffarin came out in glory.
The French
because
Prime
he was
Minister.
the only Frenchman daring to go to China at the time. And this is why Chinese authorities are so grateful to Jean-Pierre Raffarin that was brave enough to go to China when every company, every corporation was advising their staff not to go. I was working in France at the time, and we were warned not to go to China, and we cancelled a big event at the time. So at the same time, in 2003, there was as big a scare in Europe. I think what has changed, as you've rightly said, is the amplification that all the media and also the attraction and also the feeling about China is now. Everything coming from China in the last 6-9 months came out, I should say, bad. Hong Kong came out
so?
bad.
Yeah.
The slowdown in growth came out bad.
The what?
So we don't know yet. It's still early to tell whether we face something which is as huge or as big in terms of consequence as it can be. But it's true that it comes out in an ambience where lots of things coming out from China, unfortunately for China, are perceived as bad for the moment because of a combination of contexts which are negative as opposed to contexts which used to be very positive about China in the past.
Yang Zhongguang comes at a time when China has an image problem.
Image in terms of the government reputation, I think now seems to be very clear that there's some kind of cover-up going on at the local level. And the local governments and the central health authorities probably also failed to take effective, decisive actions to prevent the spread.
Hang on, you say a
disease.
cover-up. Explain.
Well, by cover-up means that to withhold information from the public, according to a report from the Shane magazine, the 15 healthcare workers were infected during January 12th and January 20th, but apparently tried to downplay the seriousness of the problem. The local government chose not to report the infections until January 20th.
They waited until January the 20th, and so has that shaken confidence in the government from within China?
Yeah, that my understanding is that many of the Chinese people who is active on the social media, they were not happy with this kind of cover-up. Some were even comparing that with the cover-up during the 2002-2003 SARS outbreak.
Can I say something here? Like, as a regular Chinese citizen, so what I feel is that this time, I mean, if the local government really discovered a really bad disease, I think it's reasonable that it will hold for a few days and then report to the central government. I think it's not a local decision to make how you report, how you publish this information to the public, because it has to be managed. It's a country of, I don't know how many people
1.4 billion.
More than that, I think it's so let's say 1.4 billion still. By the end of the day, this situation, I think it has to be coming from the top government, especially when you have defined actually this virus spread really, really quickly. You can't do it on a city level. It's not within your authority. I think it's very reasonable.
Yeah. You know, in Chinese, as you know very well, a crisis is defined as a problem and opportunity as well. So I think at the point where we stand now, where indeed for foreign opinion, China tends to be very low in foreign opinion. If China comes out well out of this crisis, it's a wonderful opportunity to reverse the current trend. So it's a very interesting challenge for the current power in China to show that with a similar situation as SARS in 2003, management can be better. So it's a perfect timing to assess how good is the Chinese government so far in such a crisis, and two, how a Chinese leader for WHO, because we have to remind that the head of WHO currently is a Chinese. So if a Chinese at the head of WHO manages this global crisis and this Chinese crisis very well, I think it turns out to be an opportunity for China to reverse. Then if it doesn't go well, unfortunately, that would not be an opportunity.
Let me bring in Dr. Munir before we go to the break. Dr. Munir, how do you do it? How much do you, because there's two aspects to this. There's the prevention aspect, how much you put people under lockdown, that sort of thing. And there's also the public relations, the communications aspect of it. When do you go, when do you hit the panic button, if you will? When do you really go whole hog in your communication if you're the authorities?
Yeah, I think if I go a little bit back, just to add up in the conversation that has been on before, I think we have learned enough from 2003 SARS outbreak. This time, Chinese government has worked incredibly fast. So if we recall the diagnosis of the SARS, it took months to reach to a conclusion that it is a version of the coronavirus. In current situation, it took only a couple of days, really, from mysterious to a few cases, and within that, we started to report about the disease itself. So I must say that we should appreciate the effort Chinese government has put. So within 2 weeks, the whole genome of the sequence of the genetic makeup of the virus was become available for international scientific communities. That really helped us to not only develop new diagnostic assays, but also start thinking about developing new vaccines, start looking into the evolution of the virus, start looking into where the virus has come from. So now we are reaching relatively closer, based on my analysis and analysis of my colleagues that I am in contact with, that this virus is not very far from viruses that have been circulating in bats and other animals. So we are getting relatively closer to find those answers that would have not been possible if the Chinese government would have not put this extensive effort to make these sequences and the information available.
All right, we're going to talk more about the response when we come back. We'll take a very quick break. You're watching the France 24 debate. Welcome back, or welcome if you're just joining us. It's the France 24 debate. We're asking if we should worry with the coronavirus epidemic that started in the central Chinese city of Wuhan and has now claimed 17 lives there, has begun to spread abroad. We're talking about with Yanzhong Huang, Senior Fellow for Global Health at the Council on Foreign Relations, who joins us from New York City. Joining us here in the studio, Jia Li, who lived through the 2003 SARS epidemic, Jean-François Di Meglio of the Asia Center here in Paris, the think tank, and Dr. Mohammed Munir of Lancaster University, who joins us from England. We were talking just before the break, coming under scrutiny, the response of Chinese authorities. Thomas Waterhouse has more on that.
With the number of confirmed cases creeping up, a belts and braces approach is being firmly enforced in the birthplace of the deadly coronavirus. In the central city of Wuhan, health officials have been zipping into their protective gear to treat and test locals who flocked to clinics. While at the railway station, mask-wearing staff remain glued to these screens, which can detect if any passengers have an abnormal temperature. China's Health Commission says public spaces and transport hubs will now be disinfected and better ventilated, with the virus set to mutate and spread.
There's already been human-to-human transmission, the infection of medical workers, and to a certain extent, community-based transmission. Evidence has shown that the disease is transmitted through the respiratory tract, and there's a possibility of viral mutation and the risk of further spread.
Officials say research efforts are being increased to try and detect the source and better understand the outbreak. But the head of China's Center for Disease Control and Prevention says a seafood market in Wuhan, where live animals are sold, is the likely epicenter of the virus, which has already gone global and has affected 13 Chinese provinces, autonomous regions and cities. A 52-year-old businesswoman from Wuhan is the first case to be reported in the popular gambling resort of Macau, where tourist visits have now been discouraged. With billions set to pack their bags and crisscross the country for the imminent Lunar New Year festivities, officials hope this outbreak won't be similar in scale to the SARS epidemic, which killed nearly 650 people between 2002 and 2003.
Now, before the break, Yan Zhongwang, you heard Dr. Munir say that contrary to 2003, Chinese authorities quick to share information on what they had, and the response had been much quicker. You agree?
Well, I think the government indeed share the virus information with the international community, and they have, I believe, they have drawn some lessons from the SARS outbreak. But according to some global health experts, the government share the information about the virus only amid increasing pressure from the international scientific community.
The authorities in China announcing this Wednesday that they were discouraging public gatherings at the outset of Chinese New Year festivities. Discouraging, but so far not banning. How far should they go in Wuhan?
Well, I think given that there are no effective treatment to the disease, and if you look at the treatment plans, essentially there's no fundamental difference between the plans and the 2003, the SARS treatment plan. So the social distancing measures, that remains a very important means to control and prevent the infection.
Dr. Munir, do you agree?
Well, to some extent, yes, I do. However, if we talk about a big country like China, there are certain limitations always that you have to compromise and live with that. And to be honest, with the current situation we have, although we have been very successful in the future to contain and restrict the infections without having any vaccine or treatment available, the current pattern of this disease is not as worse as it was in SARS. So I think we should take the things step by step. I do feel sympathy for the 17 casualties so far. However, this is what we are talking about, billions of people. So depending on what is the outcome of the WHO today, I think that would be one of the decisive factors, how intensive the control measure and the implementation of the restrictions on to gathering, but also on to the wider community need to be implemented.
All right, just to make clear for our viewers, Wuhan, the most populous city in that part of central China. It's home to 11 million people. It's also a rail hub for the rest of the country. Here you see a map showing the so it's got several high-speed lines that transit through alongside its international airport. So it's a key travel hub.
Yes.
And Xiaoli, would putting a lockdown on a city like Wuhan, is that ahead of Chinese New Year? Is that effectively the same thing as canceling Christmas?
Yes. but I think maybe it's possible to cancel Christmas in France, but it's not possible to cancel Chinese New Year in my country. I mean, personally, I'm not expert in disease and all this, but I think it's not necessary so far. Even though it spread really fast, the number of deaths and the number of infections are quite small considering the number of my population. So, and I believe after SARS, the government already have proper procedures in place and experiences. I'm sure they are managing the situation as it should. If it reaches a stage that, trains should be stopped and people should be, isolated where they are, then they will do it. But so far, if the government is not doing it, I believe it's not necessary at this point of time.
All right, when the SARS flu of 2003 struck, the pressure wasn't on just one single man, but by concentrating more power for himself than any of his predecessors since Mao, Xi Jinping, you could say, making himself a magnet for both praise and criticism. And while the president is currently on a tour of southwestern Yunnan province, it's up to his underlings to manage the crisis back in Beijing.
We believe that under the strong leadership of the Party Central Committee, the new coronavirus outbreak in Wuhan will be brought under control.
You were telling us in part one of our discussion, Jean-François Dimega, that there are high stakes here for China, and high stakes, you could say, for China's leader, Xi Jinping.
Absolutely. I'm making the point that this is a very interesting situation for China at the moment we are. Because in a way, China needs the world. And this is a specific case where China does need the world. China showed that they do need some people from outside. And the first example of China needing people from the outside was, to Taiwan's surprise, to call in 3 doctors from Taiwan, which was a gesture of not only hospitality, but also opening up to Taiwan right after the presidential election, which was an event of big tensions, of course, because between the two sides of the strait. So if China has to disclose to the world what's happening in China, if China calls in doctors not only from Taiwan, but possibly from other places of the world, then China would show that, contrary to what has been said throughout the 2-3 years before, possibly China needs Xi Jinping, and let's not challenge that. But Xi Jinping also needs people, leaders, and people from the strait, from other parts of the world, because they can help China. And as big as this can be, or as small as it can be, China definitely cannot close down on itself on such a case. They have to open up, they have to speak out, they have to communicate, and they also have to benefit from the help that many people are ready to bring in.
Yanzhong Wang, you agree?
Well, I think I agree that this outbreak presents both opportunities and challenges to Chinese leadership. Challenges basically exist in the biological world. We've seen that probably it's still the initial stages of the outbreak, and according to a leading virologist based in Hong Kong, this trajectory seems to be similar to what we saw during the 2002-2003 outbreak. So people's health and life-being, including China's the international reputation, now at stake. But in the meantime, that also presents opportunity for the top leaders, including President Xi, in that if they could rapidly stamp the virus, the outbreak, it's going to boost its legitimacy, and that we have seen actually during the SARS outbreak.
Boost its legitimacy more than during the SARS outbreak, is what you're saying?
Exactly, boost the legitimacy of the leadership and the regime, because the regime, we know it's performance-based and basically based on its ability to deliver the the public goods and services and ability to achieve concrete goals.
Jean-François Demega, you mentioned calling in those doctors from Taiwan, those medical experts from Taiwan, the newly re-elected president, among those wary of China's openness when it comes to managing the crisis.
I especially want to urge China that as a member of the international community, it could fulfill its responsibilities and make the situation of its outbreak transparent, and share accurate information with Taiwan. This is also in the interests of Chinese nationals. We also believe that political concerns should not be above the protection of its own people.
How do you interpret those remarks? Is that just political rhetoric for domestic consumption?
Well, I think that makes full sense. It comes out from Taiwan, but it should come out from countries neighboring China, and I think it should come from everyone from the world. You just cannot, in a case like this, close down and keep the information, as fast.
But are they keeping the information?
Exactly.
No. I mean, keeping information, we could see just a few minutes ago that it was indeed open, but sharing expertise, sharing information about what's happening, not only the fact that there is an outbreak, but also how it develops. I think it would benefit the whole world and it would benefit China. I think it's a perfect example of you just cannot, in a globalized world, which has been globalized thanks to China in a big part, you just cannot deal with something on your own. And the fact that, once again, China was adamant as having its representative as head of WHO meant that China is ready to cooperate. So this is a perfect example for China that beyond having the head of WHO being Chinese, there is a global cooperation on such a case. So far, we did not have negative signs. I'm not saying so, but I'm saying that we are probably to expect more and more positive signs of opening up.
Well, thank you, because actually I want to ask, has China this time done anything that shows the world that it's covering information? Because as a regular Chinese, I feel like I have a lot of information online that I can see, and the numbers are updating all the time.
This I did not challenge. I fully agree with that. What I'm saying is that in such a case, because this happens in China today, but it can happen in another country tomorrow. It's not a Chinese case. I mean, you can have an outbreak of a disease, a different disease, in another country. When you take the example of where it took place, and if you cooperate, then you improve the global knowledge.
Yeah.
And not only should you cure the Chinese population or everyone who has been, of course, affected by this specific disease, but you have to share the information. I'm confident, once again, that that should be the case. And if it comes out positive, then it's a big bonus for China, because this image of China that I described at the very beginning, whereby it's slow to cooperate, it's difficult to cooperate, it's difficult to do things with China. Well, if you can just wipe away this image that China has built up during the last 2-3 years, then it's a big bonus for China. And sometimes, sometimes I compare the current situation in China. I know my Chinese interlocutors don't like it very much, which was what's happening in Japan, with Japan, in the 80s. Japan was not very much liked abroad. And Japan started to be better liked when it had problems. And when it had problems, it called in people who could help Japan reform and use their own knowledge and expertise. If China does that in such a crisis, everyone will be a winner.
Because there had been, you've been saying this on previous shows, a period where there was more dialogue between academics, and so the same thing applies
Absolutely.
to the medical field. There's one other aspect before we go that we really need to touch on, which is the World Health Organization's challenges. Back in 2009, there was a bird flu epidemic that had the WHO declaring a worldwide emergency. There were giant public service campaigns. Here in France, the same health minister who was front and center in that campaign, who very publicly had got herself a flu shot. Well, she had to then send back 50 million vaccines. It cost the French taxpayers 382 million euros. Dr. Mohamed Munir, it's a tricky one, isn't it? How much do you sound the alarm? What is overreacting? What is not enough when it comes to an epidemic like this one?
Yeah, I mean, thanks for touching this one up. It's really important thing. And to be honest, it's not very difficult to answer this one. The reason is that if I talk about as a health expert or as a virologist, I can clearly see that such type of cases are not straightforward. These are complex situations which involve academics, which involve health professionals, which involves policymakers, which involve environmental factors, cultural factors, and a lot of other factors are involved to really make any.
Because there were accusations in 2010, after where they did forensics on all of it, that it was the pharmaceutical lobby that pushed the buying of these vaccines that in the end didn't prove necessary. How do you know at a stage like the one we're at now whether or not we need to make millions and millions of vaccines?
Precisely. So if you can recall, when this outbreak started, we didn't know the cause for this one. So at that time, if China would have given a panic situation to the whole world, we would probably be acting blindly until we reach to some conclusive information that this is caused by a virus and virus belongs to coronavirus. Then the strategy would be more streamlined. Speaking on the health side of it, I think whatever has been done so far has been right onto the spot, the way we should have been doing. Within 3 weeks, if WHO called for an emergency meeting, I think that is backed up by the information given by China and the interest of the scientific community and academics into the field.
So it is possible not to overreact in the way it was done in 2009?
Well, there are two aspects. One thing is a reaction. Another thing is being panic about it. I always been saying that we do not need to be panic. However, we need to take this thing very seriously. We have managed such diseases before convincingly. You were mentioning about bird flu in 2009. Actually, it was swine flu. It wasn't bird flu. But we did manage to control that one very effectively. We did manage to control SARS. We did manage to control Ebola, Zika, all of those diseases when there was no any vaccine or the drug available, right? So we have a full potential to do it based on the current capabilities around the world. But the key point here is that we work precisely, we work cooperatively, and we really hit the spot that is needed to be done right at that particular time. And based on my information and my knowledge and my work within this field, I think we are moving to the right direction.
Yang Zhongguang, you agree?
Well, I do. In hindsight, that I believe that we sort of overreacted to the 2009 H1N1 pandemic. But again, when we are facing a novel virus, that is what we call the dreaded risks. Then people tend to exaggerate the risks posed by the virus, and that kind of fear would lead to sort of overreaction. So I think it's quite natural, because if you conduct the risk analysis, you not only look at the likelihood, but also look at the consequences. Sometimes we have to err on the side of caution in order to prevent the worst outcomes to happen.
All right, err on the side of caution and don't panic. Yang Zhongguang, many thanks for joining us from New York City. I want to thank Dr. Mohamed Munir for being with us from Lancaster in England. I also want to thank Xia Li and Jean-François Di Meglio. Stay with us. Media Watch is next. And we say hello to James Creedon.
Hi, Francois. So, as is often the case with a story like this, it is taking up a lot of space on social networks, but that can be anything from fear-mongering and conspiracy theories, which I think it's probably better just not to show, to official organisations such as the WHO putting up as much information about the virus as can be garnered at this point. So you have Q&As, you have doctors and people who are able to sort of provide authoritative answers on this, sharing their points of view online. So there is a lot of data floating around on social media amidst the fear-mongering and the conspiracy theories. So World Health Organization there in different guises sharing information. Also the Red Cross, here's what you need to know about the coronavirus. So it's been broken down into pretty simple information for people to digest and with all of the warnings that we've been hearing already. The SARS-like coronavirus is creating real-life scenes like this, shares one Twitter user. Stay safe out there. And indeed, of course, we are seeing precautions being taken like that on flights and elsewhere. The number of cases in an outbreak of a new strain of coronavirus in China is likely to have been grossly underestimated. So that's another talking point on social media, the fact that the facts and figures, well, they're being questioned by some. One interesting piece of information that went up online, the French journalist Pierre Aski, now he was the Beijing correspondent for Libération at the time of the outbreak of the SARS virus in 2003, and he writes how the Chinese capital went into lockdown, that figures at the time of those struck by the virus were vastly under-published, and that this time around we're seeing that it's very much from the point of view of Chinese credibility, there's a desire to not have a repeat of that. At the time, the health minister was sacked, various other senior officials were sacked because of figures being downplayed. And this time, from Pierre Aski's point of view, there is a real desire to avoid a repeat of that. So that was one piece of, I suppose, a witness statement from 2003 that's got a lot of traction. Then you have people being a little bit facetious.
Yeah, everyone's an expert. Everyone's a comic, huh?
Right. The fear factor. I suppose it's people are getting humorous online about it, and that image has kind of done the rounds as well, because in fact a lot of protective masks have sold out in supermarkets because of that fear factor. I'll finish with one comment linking to another news story. Two hashtags there, coronavirus and Carlos Ghosn. Some kind of hoping that that the coronavirus won't be quite as porous when it comes to airports and crossing borders as the inimitable Carlos Ghosn.
I want to pick up on something you said. Jean-François Demilio, you heard James Creedon talk about face masks selling out. Shares in them have soared. But we're also seeing travel companies, airlines, not just Chinese airlines, but U.S. airlines, cruise companies, their shares down. It shows just how much China's might has increased since 2003.
Huge leverage on travel economy, because most travel companies are betting on the increase of Chinese travelers, which are probably already the most numerous travelers in the world.
Including here to Paris.
I think also the share of the luxury brands in Europe.
That's right. It's
They are going down.
Yeah. They've gone down on news that it was.
And indeed, Pierre Aski made that point as well in that piece this morning, that it's a completely different China compared to 2003. Much more Chinese people travelling, and much higher stakes for China as well in terms of protecting its reputation.
All right, many thanks for that, James Creedon. I want to thank our panel once again. Thank you for joining us here in the France 24 debate.